Our topic is autism and voice. We have a client who is 17 years old and he's on the spectrum, and he has a high-frequency voice. So our outcomes, what we want you to know, is students will utilize instrumentation such as wave surfer as a therapy technique, and students will gain knowledge of the best therapy techniques used for rare voice disorders for teens on the autism spectrum, such as. So as we all know, that autism spectrum is a spectrum disorder, so it can be characterized by many different things, and social interaction is one of the biggest things, so he's probably going to be impaired with social aspects, which is also going to be impacted by his high-frequency voice. So like I said, he's 17 years old, he's on the spectrum, he has a high-frequency voice, and there's limited research on high-frequency voice. Most of it was just monotone robotic. So we did the best we could with our therapy techniques.
Okay, we decided to go along with our first short-term objective for Joseph to identify gender and age-appropriate voice. To use Wave Surfer, in therapy, the clinicians will utilize Wave Surfer to show Joseph the difference in frequency between his voice and the average fundamental frequency of a male, around 150 hertz. Or if there was a male clinician, that would probably be great to do. The clinicians will compare vocal recordings from a male that are gender and age appropriate with Joseph's voice during session. The clinicians will choose the pitch contour features on Wave Surfer to show a side-by-side comparison of the difference in vocal pitch between the two males. Joseph will identify the gender and age-appropriate voice frequencies in an auditory discrimination test on Wave Surfers. And the clinicians will utilize visual and auditory stimuli to help Joseph determine what his target voice should be. So we felt that the auditory discrimination test, along with the visual help of Wave Surfer, would help Joseph gain a greater understanding of what his voice sounds like to what is more normal for it to sound like. And this was Joseph's fundamental frequency was around 304 hertz, which is very high. We were showing him recordings that were around 150 hertz, so he understands that it has to be a much lower vocal quality.
Okay, so to elicit his target voice, once Joseph is successful in identifying appropriate vocal qualities and how his vocal qualities vary from, I guess, the norm, you would say, we can implement strategies. According to Dean and Miller, the appropriate fundamental frequency should be developed, and clinicians use the following progression. First, we started with deep breath and throat clearing to establish a low voice quality, and then we used the throat clearing and blended it into a sustained ah, and then from there you just do the sustained ah formation with a low vocal quality. And the clinicians will model and imitate throughout this whole progression, and if successful with producing a sustained ah with a lower fundamental frequency, Joseph will continue to use the target voice, working up through a production hierarchy. So following sustained ah, other vowels should be elicited, and then following vowel mastery, the syllable, word, sentence, and conversational levels can be other suggested outcomes. Some other considerations: this therapy can be easily modified to fit the client's needs, and Joseph, a teen on the spectrum, may also need support from the SLPs to work on pragmatically appropriate situations where he should use his target voice. So like, for example, if he's in school or out to dinner, I don't think it would be appropriate for him to sound like, "Hello, hi, my name is Joseph." That just doesn't sound right. So this is our,
I'm Joseph.
yeah, she's Joseph. And we were doing the throat clearing into the ah. It's a little quick clip.
Hi Joseph, how are you today? It's good. Today we're going to work on lowering our voices. I wanted you to take a deep breath and then clear your throat. Good job. Did you hear how low your voice sounded? Good. That's your target voice for today. So now I want you to clear your throat multiple times. job. Now we're going to clear our throats and make an ah sound at the end of it. Watch me. Good job.
And so then hopefully it would follow the progression, sustained phonation of ah, then following the rest of the vowels, then the word level, and on up through the hierarchy. We used therapy guidelines for patients with mutational falsetto because, like we said, there was not that much research we could find, and you know, since autism spectrum, people who are diagnosed with it, everything varies so much. We tried to come up with a therapy plan that could be modified, and but the client is a little older, so we were just hoping to find something.
If with a younger
appropriate for his
client, you
needs.
could potentially use busy pitch or something like that, but he's 17, so it might be a little,
Depending where he was on the spectrum,
we would be able to use it or not.
any questions?
Yeah.